We are already live, and thank you very much. Thank you, ladies and gentlemen, for joining this session. This session is Africa Health Agenda International Conference 2021. This session is supported by Malaria No More UK, the government, private sector, and young people. We welcome you all to the session. This session, we will be drawing the line against malaria. Zero malaria starts with me. We're all taking that stand today. We hope that's why we're in this session. My name is Wariko Waita, and I will be your moderator for this session today. Welcome you all. We will have a very robust engagement, and we are starting with spoken word from Teardrop and Ambassa Mandela, spoken word poetry, and that is how we'll start. And over to you, Teardrop. Take it away.
Can we be heard?
Can you hear the guitar?
Loud and clear.
Let's draw the line. There you are, here we are. You will never be in our stories and histories, man. You'll never be. You will never be.
Oh, go be malaria. Malaria. Let's draw the line.
Let's draw the line.
Malaria no more. Yeah.
Malaria no more, no more.
Check it.
No more.
You're never too small to make an impact. Because what mosquito does is sting and bite. And by this act alone, it's giving warriors and kings, both sane and insane men, sleepless night. The mosquito is small, but its impact, it's big. It's being discussed by delegates from just one bite. Malaria, shame on you. Mothers are carrying their children for 9 months. They're just killing them after every 2 minutes. Malaria, shame on you. Why don't you pick your size? Pregnant women and children under 5 years, really? Yeah, you've started another world war because malaria, by the time we are done with you, you'll know that our blood is meant to donate and save lives, not to be drained on our vein in vain. Malaria, we are going to tie you on a chair and make you stare how our water is flowing. All your eggs you've laid on our stagnant water will be pushed to the sewer land, and we'll make sure you stay away and stare and watch your generations going down the drain. All the mosquitoes depending on will be crying in pain at Wogopi malaria, because by the time we're done with you, you'll be getting an actual fever. Malaria will put you down in the mud because we know at Wogopi malaria, and you won't steal our future. Malaria, we are too much for you, too strong for you. It's time to take back our future. Yes, we survived COVID, we survived the Great Depression, we survived influenza. We will deal with you from your head to your mosquitoes. Malaria, we're gonna chase you with the speed of Eliud. We're gonna kick you.
Let us draw the line. Here is no more. See you open
Malaria. Almangamize malaria.
Oh, let us draw the line. Malaria no more, no more, no more. Done with you. We're gonna kick you, bend you like bacon. And you don't know what you're playing with. Draw a line.
Thank you. Malaria no more.
Malaria no more.
Welcome, welcome. That was fantastic. Thank you so much. Wow, wow. That was brought to you by Teardrop and Ambassa Mandela. Those who are joining us now, welcome to the session. That is how we open by drawing the line for malaria. I myself have drawn the line. We're too united for malaria. If you can, please scroll over your photos on the Zoom chat, and there are 3 dots, and you can update or rename your profile by first name, and then your put your keyword, too fast, too bold, too united, and really too strong for malaria. Today we are drawing a line, and we have an excellent group of panelists. And also, perhaps this is an opportunity to wish all of us who celebrated yesterday and who are celebrating the month, happy International Women's Month. We heard about under 5s and mothers being threatened by malaria, but we're saying today we draw the line and we want that to stop. So welcome all. I will quickly go through and introduce our panelists and have them just say a word or two before we get into that. Dr. Amable, joining us from the Ministry of Health, Rwanda. Welcome to the panel. Over to you, Dr. Amable.
Hello, everyone. Happy to join. This is Dr. Mabrembitumremi from Rwanda. I'm the head of the National Malaria and NTD Control Programs. And I have a strong word today for malaria. Malaria, ready to defeat you.
Excellent, excellent. Great artwork. Very good, Dr. Excellent. Next, we have Dr. Mercy Mwangangi, Chief Administrative Secretary, Ministry of Health. Over to you, Dr. Mwangangi. Pleasure to have you here.
Thank you. My name is Dr. Mercy Mwangangi, and my artwork says, "We are too tough for you, malaria." So 2 in 1. Thank you.
We do know you're a tough lady and doing a great job. It's a pleasure to have you on this panel. Thank you very much. Next, we have a young person, William Decker. Over to you. Welcome.
Bonjour, good afternoon. My name is William Decker. I'm a youth advocate, but also a specialist in communication. And in this case, also a member of the African Leaders Malaria Alliance Youth Army, or if you like, the Alma Youth Army. Of course, I'm too wise for malaria. Thank you.
Yes, our young people are certainly wise. So good to have you on the panel. Followed by Bridget Washira from GlaxoSmithKline. Over to you, Bridget.
Good afternoon to you all. My name is Bridget. I have worked for GlaxoSmithKline for the last 20 years across the African continent, and I've really had the privilege to witness the amount of significant effort and work we've put towards defeating this disease, and I believe it is a disease we can eradicate in our lifetime.
Thank you so much, and it's so good to have this partnership with the private sector. It means a lot. Finally, we have Lilis Jenga, the Africa Director of Malaria No More UK. Over to you.
Thank you very much, and good morning, good afternoon, everybody. My name is Lilis Janga, Africa Director at Malaria No More. Over the last 10 years, Malaria No More has been supporting and working with the global malaria community to deliver groundbreaking mass communication and advocacy campaigns. All this with the vision of having a world where no one dies of this preventable and treatable disease. And beginning this year, we shall be leveraging on this global experience and expertise to support innovative and sustained advocacy and communication for malaria at a regional, national, and subnational level in Africa towards meeting respective countries and continents' targets for malaria. And today I'm telling malaria, I'm too bold for you.
Too bold, too wise, thank you so much, Lilis. And that's it. This is our panel. We look forward to an engaging session. Those who are joining us now, we welcome you. We've already started. We've had some spoken poetry word, which was really inspiring from our young people. We'll get right into it. Now that all of us have taken a position to draw the line on malaria. Let us start with Dr. Amable. Dr. Amable, give us your words of wisdom as we gather here today.
Thank you so much for having me today. It's my greatest pleasure to be with you to share some few thoughts about our global is zero malaria really possible? I think this is a great question, and everyone here is concerned. And I also ask you a question. For me, from the last 20 years, I have not been infected with malaria. How about you? If no infection, this means that malaria, zero malaria is possible for everyone. Now the question is, what do I use to make it happen? Just to share with you that where I stay, where I live, my neighbors used to have like malaria infection twice a year. Yet we share the same context. We share the same mosquito breeding site in the village, but the difference is at home. And the zero malaria starts with me is a reality, because you can do the same thing and have the same result. But if you share the same context, but you do not do the same, you may not expect the same result. Just one more experience beyond one village. When I joined the program, it was in 2016, and I was received by a message from the high level telling that there was an outbreak in one district. It's normally a low burden district. It was during the dry season, where normally you don't expect malaria increase. When we went there, we could see that in 1 month, they had recorded 18,000 cases a month, with 10 people who had already died from malaria. And when we went there to investigate, we could see that yet it is really in a low burden district during the dry season, what was really abnormal to have that malaria increase. But you could see that where they had mosquito breeding site, it was due to bricks production during the dry season, and water bodies could stay longer even beyond the dry season and could extend up to dry season. And this was really abnormal. And now the local leaders were calling the central level, the Ministry of Health, to go there and do indoor residual spraying. This was really challenging for the program because we had no fund for that. We are fighting to address malaria increase in the southern and eastern province, where we are recording more than 80% of the national malaria burden, and you had no fund for IRS there. And those people in western province were asking to go there and spray. This was not possible. But when we went there, we could identify those mosquito breeding sites, and yet we said, no, please look where mosquitoes are coming from. You are the one creating those holes because of vehicles, trucks carrying bricks, and you are not removing those breeding sites after your work, and you are creating your enemy around you. It was from Monday to Friday, educating people, showing them mosquito larvae where they are, surrounding their houses. Then we said, let us call all local leaders to conduct what we have in Rwanda. We call it community work. People gather every month and do hygiene, cleaning the surroundings. Then we focus on that only for malaria control. The next month, you can imagine what happened. There was a drop from 18,000 per month to 1,000 cases the next month. From 2016 now, less than 2,000 cases are recorded per month in that specific district because of engaging local leaders, local communities. But the question, why don't they go up to zero? Right. In summary, I can see that zero malaria is possible, but we need to combine our effort. Thank you.
Excellent. Involving community leaders. Dr. Mwangangi, is zero malaria really possible?
Thank you, Wariko, and thank you to my brother from Rwanda. And I just want to join him by saying, yes, indeed, zero malaria is possible. The same effects that he's seen in Rwanda, we are seeing them in Kenya. Kenya is continuously reporting lower and lower rates when it comes to the prevalence of malaria across the country. And when we focus towards our high endemic regions, our high disease burden regions, we are seeing declines when it comes to outpatient visits, when it comes to malaria. And this really is a pointer and a sign that indeed zero malaria is truly possible. And so far, my brother from Rwanda has shared with us the role that communities play. I would like to add on to this and say that private sector also should be layered on to communities. In Kenya, we are taking a dramatic approach, engaging the private sector when it comes to elimination of malaria. We've been able to put up stakeholder groups, an End Malaria Council, with the aim of bringing together all the different stakeholders when it comes to therapeutics, when it comes to manufacturing of nets, when it comes to provision of medicines. We're coming together on the table with government, with private sector, to discuss how we can indeed ensure that zero malaria is a reality. Thank you.
Excellent, very encouraging. Thank you so much, Dr. Mwangangi. Lilith, let's come to you. Same question, is this possible?
Yes, this is possible. And I just want to mention the role that advocacy and communication really will play in this. As we know, malaria cripples economies, crushes communities, and cause heartbreaking loss. And advocacy and communications tie all the different aspects together, including progress and success towards malaria elimination. So advocacy and communication have the potential to mobilize resources, both in terms of the people and the funds needed to end malaria. And of course, effective advocacy communication needs to resonate at community, subnational, and national and international level to make all these happen. And for example, through communication campaigns, we have seen the youth come together around Africa, breaking borders and joining in one voice across on issues that affect them. So it is possible for them to join hands in the same way and make this a reality. Advocacy and communication help us to articulate how malaria affects each and every one of us directly or indirectly, what each of us can do, and help us to celebrate progress and highlight opportunities to enable leverage transformational resources and commitments to end malaria. So having this as something that binds all the different aspects, we can do it, it can be done. Thank you.
Thank you so much, Lilith. From what I'm hearing, there's a role for everybody in this, from community to private sector, communications and advocacy. Everybody needs to do their part. And this is why we're all here. The diverse panel already indicates that we are well on our way. For those who have just joined us, we are discussing drawing the line on malaria, and that zero malaria is indeed possible. If you've heard part of the presentation, if you have questions and comments, please post them in the chat. We'll be getting that, responding to those at the end of the session. So please just drop them there and we'll be noting them and coming back to you. So thank you for that. Let us continue in terms of what will it take to make this happen. We've heard the prelude on who it needs to be involved. Dr. Amable, I'm going to come back to you. You talked about community and you really gave us a detail in terms of what you're really seeing in terms of impact. What really will it take to make this happen? Coming back to you, Dr. Amable. You're on mute, please unmute. Dr. Amable, please unmute. We're not receiving your audio. Please unmute.
Yeah, the first, yeah, sorry,
Okay,
thank you. I said that the first thing is to make sure that people understand what is the issue they are facing, because before that, clear communication, showing data in a given area and discuss with everyone who should be on board. For the last 5 years, we've been fighting with malaria as the Ministry of Health alone. But since we started using data, we could share with the different ministries, Ministry of Agriculture, Ministry of Education, local leaders, to make sure that they now understand why we need to join our effort. This is the first step. Then the next one will be very easy.
thank you very, very much for those succinct comments, and we agree. I think that is it. Dr. Mwangangi, same question. What will it take to make this happen? Please unmute.
Thank you. Thank you. So indeed, to again agree with my brother, for this to happen, one of the things that we found to be instrumental in Kenya is the utilization of a multi-sectoral approach. The ministries of health and health sectors have been able to put in place different strategies when it comes to malaria management. Strategies that touch on advocacy and awareness, strategies that touch on malaria control, vector control, strategies that touch on communities when it comes to use of nets, and then of course, case management when it comes to medication and treatment for malaria. But one new thing that we're trying to implement in Kenya is to then extend this outside of the health sector, to have the participation of other ministries, such as the Ministry of Gender, the Ministry of Youth, and you really have, their policies also reflect malaria control. And one of the successful things that has been launched in Kenya through an initiative by our president is that we now have a group of young people. We are calling them the Malaria Army. And they're out there in communities, putting in place interventions against malaria, cutting bushes, draining swamps, draining, water bodies in terms of trying to ensure that we have good vector control for malaria. And this is only possible through multi-sectoral collaboration. Thank you.
Excellent. The Malaria Army. So here we're drawing the line, and we already know there's an army out there already working to make this happen. That is very, very profound. Thank you very much. Bridget, let's come to you. In terms of private sector, please give us some insights in terms of what your response would be to what it will take to make this happen. Over to you.
Thank you, Mariko. I think I honestly believe that malaria is that we have a shared responsibility in eradicating malaria, and that shared responsibility is for all of us. Communities, the private sector, the government, the people who bear the burden of disease, particularly mothers and children. It is our shared responsibility collectively, and I believe it is only a multi-stakeholder approach where everyone contributes, whether little or big, to this shared responsibility, and one where I hope, particularly after this conference, involves everybody, particularly the youth. They are the future of tomorrow, they are the future of Africa, and they need to be involved in eradicating this so that they can have the future they deserve.
Very profound. And I think an excellent segue. The youth need to be involved. So William Decker, let's come to you. With the same question, what does it take to make this really happen? Give us your insights and wisdom.
I thank you. Yes, I'm too wise for malaria, so I'll share insights of wisdom. Wariko, if you allow me to share, about 2 weeks ago, I turned 28 years old. And that means I'm joining another stage of life, but still under 35 years old, which means I and my colleagues who are under 35 years old, we constitute about, 75% of the African population, so 3/4 of us. So it becomes difficult for me to accept the principle that the youth are the future of tomorrow or the leaders of tomorrow, just because having a population of 3/4 against a population of, a quarter who are taking the lead in terms of these initiatives. And you know, the golden rule about majority should always have their say. So I feel that as young people, perhaps now is the time to shun the notion that we are the leaders of tomorrow, but in turn, own up that agenda now and become the leaders of now, especially in terms of health, and more specifically now in terms of eliminating malaria. I'll also share an instance which makes me even feel stronger that the young people have a bigger opportunity. Just about a week after I'd graduated from campus, I lost my ex-campus roommate to malaria. He had only suffered symptoms for about 5 hours and of course passed on in the wee hours of the night. God rest his soul, James, yeah. And then so for a few days, then later weeks and months, I felt helpless because there's very little I could do. I'm not a doctor, as Dr. Mwangangi here or any other doctor who is on the call. But then again, sometimes we hear statistics and we say it's the mothers and of course children under the age of 5. But here I was living in one of the most malaria prone counties and seeing a colleague of mine, age mate, actually passing on, and somebody who is close to a disease I will never think that will take his life for sure. And so I felt that for sure, I as a young person, perhaps I have a role. And what role do I have? To use my youthful age and numbers that come with it, the numbers I was just splittering around here, to mobilize my fellow colleagues and the rest of us to come out and demand of action from our leaders so that they are accountable to some of these promises they've made. Throughout last year and even now, you hear most of our African leaders are making commitments towards ending malaria by 2030. And so everyone says it nicely, zero malaria starts with me. But what action are they taking to ensure that zero malaria starts with them? So it means for us as the youth, we have a role to mobilize our colleagues within the continent so that we form one unified force to demand for accountability. And how do we do so? Because at this age and time, then we have the opportunity to leverage digital technologies purposefully for these advocacy initiatives, which Lily's had mentioned as well, to ensure that we communicate and raise our voices so that once we've amplified our voices, we can change people's attitudes, but also those of our leaders, and they can take action towards ending malaria. If that answers you, Eriko.
Excellent. Thank you so much. And my condolences for the loss of your colleague, schoolmate. That means it's a personal, it's a personal fight having experienced that. So please accept our condolences and sorry for that. I'd like to go back to Dr. Amable because you talked about data in some particular area. What about regional corporations? So you may be very strong in data collection in one area. How then are you ensuring this cooperation and sharing so that this really moves beyond one compound, but across one country and again, even regionally, if we wanted to address it that way? Over to you, Dr. Amable. Please remember to unmute.
Thank you so much, Waliko. It's true that not only data sharing, but also experience sharing is very key. In case we need zero malaria, because you know that mosquitoes fly and can move from one area to another, but also people can move from one country to another, moving with the parasite. Now I can go from there and give some just a few thoughts. In our eastern part of the country, it's here we have 7 districts, and around 60% of all malaria cases were coming from that area in 2016-17. Now we use data to ensure that we secure fund for IRS, indoor residual spraying, using PMI fund, Global Fund, and the government fund. And now we have reduced malaria up to a good level, but now we still see some residual cases. We can't do more. But the only thing is that when you see few cases like 100 cases in one district, that was recording 100,000 cases a month, now recording less than 1,000 cases a month, but surrounded by other districts from Tanzania, from Uganda, or from Burundi. When you see those residual cases, we can see that those people are travelers. They are either truck drivers who are traveling from one area to another, carrying the parasite, and they can fall sick in a given area, and they are received by people, nurses there, and they can just receive medication. But you don't know if they have resistance to antimalarial drugs, but also you don't know if mosquitoes around those same districts have the same sensibility to insecticide. We have documented pediatric resistance, but yet different countries are still using the same bed net. If we shift from pediatric-based bed net to new generation like a G2 net, or we introduced PBO net, what if other countries are not shifting, yet you are sharing the same borders? I think this is now where we need to cooperate with different countries. If we need to make sure that we are getting to zero malaria, because we may not eliminate malaria if we have a resistant parasite, if we have a resistant mosquito. Sharing data is key, but also cooperating to ensure that at least we synchronize our interventions, we harmonize our intervention where needed, so that maybe if we have a given coverage of bed net distribution, are they effective or not? If there is resistance, no need to say or to think that we have reached 100% of coverage in bed net, yet there is a documented resistance that you are not aware of. I think these are just key thoughts that should indicate that we need to cooperate. In case a country has local data, local evidences, it's better to share that experience. In 2020, there was a paper that was out reporting that there is a susceptible resistance to ACTs in Rwanda. One component of antimalarial drugs we are using in Rwanda has a resistance now. But what if we do not cooperate with the region to see if one having that parasite is moving from Rwanda to Tanzania, to Uganda, to Burundi, to DRC? If they keep using the same medication, they don't do strong surveillance, probably they may not eliminate malaria, since we do not share that data. I think few ideas to show that we need regional collaboration, a strong surveillance system to ensure that we combine our effort. Where we reduce malaria, we need to make sure that our neighbors are doing the same. If we have resistance, it's better to understand if others have the same tools. And if there is a need to shift from one intervention to another, we need to share data, because sometimes you can invest, you can mobilize funds from private sector, but at the end, they ask you as government, show us the impact of our money. If we don't show the impact, the following year they say no need to continue supporting you because no result. Evidence to be used, data sharing is very key in this global fight.
Thank you so much. Thank you. Very comprehensive. We have a number of questions coming up in the chat, and I think I'll pick one up right now and take it to Dr. Mwangangi. The question is, what do you think of how we domestically finance malaria interventions? I know we have universal healthcare here in Kenya. Perhaps you want to speak about that and also maybe respond to Dr. Amable in terms of the regional cooperation. Over to you.
Thank you, Wariko. That's actually a good question for me because I'm a health financing specialist. That's what I do. So I'm sure you knew, you had that little secret there. Well, it's true. When it comes to financing malaria, you know, when we discuss all these interventions, the ones that have been highlighted by Amable from Rwanda and Bridget and Lily's, you know, I always often see financing as the encasing ball of all of our interventions. And up until the time where we have a financing mechanism that is sustainable, that is able to, continuously ensure that these resources are available and beyond being available are rationally used and allocated is quite important. Kenya, like the many countries on this panel, is on a journey when it comes to financing for malaria. And in Kenya, we've taken the approach of ensuring that malaria interventions are integrated in our universal health coverage benefit package. And so as we finance the medicines through a social health insurance fund, we're looking at mechanisms to ensure that these other interventions, the preventive promotive interventions, are also financed, but in a manner which is rational and is sustainable. It's important, and I agree with my brother from Rwanda, in as much as we may have resourcing from external partners, governments do need to commit to mobilization of resources domestically. And one of the things that we've seen working here, particularly in Kenya when it comes to malaria, is that our program is highly integrated within the service delivery modules that we have. So unlike other disease groups, which we've seen a lot of siloing in when it comes to their programming, the malaria program utilizes the country's health information system together with other diseases. So malaria program in Kenya does not have its own data system. And I know you've seen different examples, different conditions that have siloing when it comes to the programming. When it comes even to the M&E officers who work in malaria, they cut across the board, offering services in different spaces. And so I think one of the key elements when it comes to sustainability is definitely integration of these programs into normative service delivery structures. Thank you, Eriko.
Thank you so much. Bridget, let me come over to you for, some deeper insights on GSK's involvement, commitment, and innovation in this area. I'll give you a few minutes to just, take us through that. Thank you.
And thank you, Erika. GSK has a strong legacy in the fight against malaria through our scientific innovation in the context of the development of a medicine and a vaccine against malaria, but also in our partnerships that are focused on strengthening health systems and advocacy with Comic Relief, with Malaria No More, with Save the Children, and with AMREF, whom we have worked with for the last 30 years. If I speak specifically to scientific innovation, for example, tafenoquine, a single-dose cure for one of the most deadly forms of malaria, P. vivax malaria, is a medicine we've developed in collaboration with the Medicines for Malaria Venture, and it has been a journey of 60 years. It is the first treatment developed for P. vivax malaria in 60 years. And a significant burden, unfortunately, of this type of relapsing malaria is in children. So we're therefore going ahead in the spirit of partnership to study the use of of tafenoquine in young patients. But scientific innovation has little impact if it doesn't reach the vulnerable population that needs it the most. So that is why, together with our partners, the Malaria Medicines Venture and PATH, our focus is now on working to ensure tafenoquine can reach the patients who need it the most. In vaccines, it has taken 30 years for GSK, working in collaboration with PATH and other partners, to develop RTSS, which is the first vaccine against a parasite, and the first to demonstrate efficacy against P. falciparum malaria, which is a malaria that ails us in sub-Saharan Africa, and the first to receive positive regulatory review. We now have RTSS being administered in selected districts in Ghana, in Malawi, and in Kenya as part of the malaria vaccine implementation program coordinated by WHO. And I really feel proud to know that at least 600,000 children have so far received a dose of the pilot since the pilots began in 2019, despite the COVID pandemic. We hope that the data generated from the malaria vaccine implementation program will inform a WHO policy recommendation later this year on the broader use of the vaccine, which will then allow Gavi, the Gavi board, to then be able to determine whether they shall procure this vaccine. And to ensure that there's sustainability in scientific innovation, we further take on partnership. And we recently announced that GSK and PATH and the Baratak Biotech Institute signed a product transfer agreement for the RTSS vaccine, and Bharat Biotech will be the supplier of this vaccine to ensure sustainability to the countries that need it the most. But all these interventions and solutions require a strong health system. And the one thing the COVID-19 pandemic has taught us is that a country's outcome is as good as the strength of its healthcare system and its political leadership and the community's engagement, particularly the youth. And one of our partnerships with Comic Relief has supported youth-led activities in Tanzania and Sierra Leone, the things that William is calling for, training young people to develop youth-friendly malaria awareness activities, showing them how to be advocates in sharing powerful human stories, allowing youth leaders to be involved in policy and advocacy. And recently, building on the learnings and successes of our 30-year partnership with AMREF, we have recently announced a 300 million Kenya shilling program for Kenya and Ethiopia, focused on strengthening health systems to reduce the impact of malaria and TB, because we want to make sure that despite the threat of COVID-19, we cannot afford to lose the gains we have made in prevention and treatment of malaria and TB. The fight for malaria responsibility is a shared responsibility. And I'm motivated that all of us, including the private sector, if we come together as a collective stakeholder group, and as William had said, that needs to include the young people of Africa, we can eliminate malaria.
Thank you so much. And we celebrate your passion. We celebrate GSK for the commitment over the years, many years. I know you've been working, and this new partnership for Kenya and Ethiopia, we will be watching, and that will be one of the examples of us drawing the line and moving closer to zero malaria. On the chat again, and I'm coming to you, William Decker, in terms of how are the young people, how are the youth being prepared for the challenges that we are talking about today and the opportunities as well? And what is the critical role of this youth on the continent here in Africa? Over to you.
Thank you very much, Mariko. And also sincere appreciation to Bridget for actually introducing the role of the young people in terms of fighting malaria itself. To begin with, I'd like to introduce a concept that actually provides an opportunity for young people to be involved in the fight against malaria. Of course, we've talked about the Line Against Malaria campaign, and whenever you hear that, it brings for you that louder element of advocacy and holding leaders accountable for their actions towards ending malaria. And more so in partnership with Draw the Line Against Malaria is the Alma Youth Army. So Alma is an alliance of African leaders from all the 55 African countries who have come together to fight malaria. The current chair is His Excellency President Uhuru Kenyatta. So upon assuming the chairmanship of ALMA, the president, because of his passion and affiliation with the youth, had a legacy agenda that introduces the formation of an ALMA Youth Army. So the ALMA Youth Army is now what we are trying to talk about. What can the youth do? So it comes with 4 strategic areas. That is the first one being advocacy, and you are seeing Draw the Line Against Malaria campaign working very strongly on that. But then there's also other elements such as communication for change, because we know that one key element of fighting malaria is SBCC, or communication for change itself, going to the grassroots levels, training people how to do some of these things, how to use the nets, what to do in case you have symptoms. So we can leverage the power of the youth and the ability to influence using different platforms, including digital media, to create awareness on fighting malaria, to create awareness on what actions to take at the very most basic level, that is the grassroots levels at the communities. But besides also communicating, the youth are also known for their energy. And so I think it's also a good opportunity for the young people to acknowledge that they can use their youthful energy to perform community level action. And that could include some of the activities which Bridget has mentioned, and even CS Mwangangi mentioned, going to the communities to do environmental management, clearing clogged waters, clearing bushes that will act as breeding grounds for malaria. But also the youth can still also be involved in other aspects that the youth are known for, that is innovation. So it means the youth now should take it upon themselves to engage in scientific research and innovative strategies that can provide solutions for either preventing malaria, solutions that can be used for treating or even diagnosing malaria. So these solutions could even be mobile apps that provide real-time access to data, and then this data can be used to make very progressive decisions. I must reinforce the role of the youth, especially in terms of advocacy. As CS Dr. Mwangangi mentioned something about financing for malaria. As African countries where malaria is endemic, it means then perhaps it's high time for us to start looking at models of domestic financing. But now if the youth already have that knowledge, then it means they can for sure advocate for aspects of domestic financing, etc. You've also asked Wariko, then how do the youth get empowered to do this? Some of the platforms include, of course, one, the Alma Youth Army, which will be providing trainings, advocacy platforms and advocacy tools, a knowledge hub that can be used to build the capacity of young people on how to advocate, on how to communicate, and also on how to work at the community level to work towards eliminating malaria in the continent once and for all. I may have missed a question or two from you, but feel free to remind me.
No, that was very comprehensive, and thank you for that. I think at this point, unless I can call to Dr. Mwangangi, who also seems to be there near the youth, unless any comments on what has been said here, just quick thoughts on what Decca was able to share with us.
Thank you. I really do agree with Decca that it becomes more and more imperative as we continue fighting against malaria to involve the youth and to meaningfully involve them, and not just in the normative public health speak of participation in policy design, but also in the implementation, in the mobilization of resources, but also in holding different stakeholders accountable. One of the key things that our colleague from Rwanda mentioned was the use of data when it comes to the fight against malaria. And we even deliberated on the use of this data, particularly across regions in different communities, EAC communities, and all the other communities that we sit in. And one of the things we can do is leverage on the youth and their skill set when it comes to data. I've been amazed to interact with different various young people, some of who have developed fantastic models, tried to really push the envelope and looked at big data, tallied, meteorological data along with malaria data, burden data, movement of people data, to really give us better pictures when it comes to decision-making against malaria. So indeed, the youth do have a pivotal role when it comes to malaria, and because they're so savvy in data management and mining and utilization, perhaps this is one of the things that we really truly need to nest within them to run with when it comes to ensuring that zero malaria starts with us all. So really, yes, indeed, I'm an advocate. There's a lot that they can do for us. Thank you.
Thank you so much for those comments and really aligned to, I think, this campaign. Let me go back to Lilis. Lilis, there is a film that culminates this conversation, for us. Perhaps you can take a minute to introduce it and take us through it so that we can actually just, see what the true essence of the campaign is moving forward. Over to you, Lilis.
Thank you, Wariko. And just to give a bit of background on this film. So it sits under the Unifying Zero Malaria Starts With Me movement and calls on young people across Africa and all over the world to unite to fight malaria by driving more action, more innovation, more funding, and more leadership to achieve zero malaria within a generation. Today's African youth has been mentioned, are quite vibrant and ready to take it up. And this campaign features African artists and champions. And Draw the Line really is a unifying power of art and entertainment to inspire young people across Africa and the globe to drive unstoppable action to reach zero malaria. The artwork will be presented to the world leaders as a visual representation of solidarity to end malaria at the Malaria and NTD Summit in June this year. And this will be during the Commonwealth Heads of Government meeting to be held in Kigali, Rwanda. The summit is a milestone moment in the malaria fight and an enabler of game-changing political decisions, including the commitment to have malaria across the Commonwealth by 2023. So I call on us all today to draw the line against malaria. If you've not already done so, please visit zeromalaria.org to draw your line. Commit, join the march of solidarity, join the march to end malaria within a generation, and together we can do it. And now, ladies and gentlemen, I would want to share the Draw the Line Against Malaria campaign film. Please allow me to share it right now.
Malaria, we won't let you steal from us anymore. We are the generation that can end malaria.
Malaria, we are too strong for you.
We're too bold for you.
Malaria, we are too fast for you.
Malaria, I don't like you. Too fierce. Too smart for you. Malaria, don't even dare take our future with you. Malaria, you can't stop us. Nothing will keep these lines from growing. We are the generation that can end malaria.
It's time to take our future back.
Thank you.
Excellent. That was very, very bold in terms of the filming, the statements, the young people. Well done. Well done. Yes, it's a clear message where we stand, and this generation is really taking charge, and we need to allow them to do that. Excellent. So right now we have gone into the Q&A segment. We'll have a few minutes for Q&A. There's some questions that have already been answered. And Bridget, there's a compliment here on your last presentation. Bold, you know, they really enjoyed that. And your passion shone through. So well done. Well done. You did well. A lot of congratulations to the panel from the teams. And the key thing now is a question. There was about Alma, the youth army. It was brought up by Dr. Mwangangi. I think the question is, you know, ensuring young people become champions. Maybe you can just give us feedback, Dr. Mwangangi, on how this is working and what you would want to see. From what you have also said, there was a young gentleman who's actually said he's a health practitioner, he's out there, you know, really they want to get involved. So how do we ensure at this point we're also calling for those who have the skills and expertise to join this bold stand against malaria? Over to you.
Thank you. The Malaria Army is an initiative of our president, His Excellency Uhuru Kenyatta, and how he did it is one of the things that we put in place as part of economic stimulus program during the COVID-19 pandemic was to provide opportunities for young people to be involved in work, in different pieces of work across the country, and a health and sanitation program. And so we set place opportunities for young people who were unemployed to be able to participate either in the draining, of ditches across the country, in cleaning, in sanitation activities for a daily wage. And one of the ways in which then we have transformed this program, which really started as a COVID stimulus program, is to then include components of case malaria management within it, educate the youth when it comes to how to conduct different malaria control activities, utilize them when it comes to the distribution of nets, utilize them when it comes to indoor residual spraying. And so across the country, we have close to about 100,000 of them who are designated in different parts of the country. And we engage with them. Part of the malaria program in Kenya engages with them, gives them capacity building, resourcing in terms of them being able to understand, can communicate to the communities as they engage and interact in their duties. But it doesn't end there. I'm pleased to note in the chat that in Kigali as well, they are looking to set up a malaria army as well for youth. And through different initiatives there, the idea is just
Hello, I think we lost you. Can you hear us? Just give it a minute.
Wariko, as you wait for Dr. Mwangangi to come in, possibly I could also mention that for anyone who is asking how do they get to join or to be part of the Malaria Youth Army in their own countries, the first option is you can reach to the National Malaria Control Programs. In the Kenyan context is the Division of National Malaria Program. Alternatively, you could also reach out to ALMA, the email address P for Paul or P for Peter. So it's ppaul@alma2030.org. And then they'll be directed as appropriate. Thank you. No.
Thank you so much. We're now getting to the point of would you like to add any more as your parting shot as we close the session, Deka?
Well, a lot has been said, so I wouldn't want to wrap all that by introducing another speech. Perhaps I will just let my fellow young people know that being the largest demographic population within this continent, then it's time for us to take charge and know that it's us who have to own the health agenda, and it's us who have to own the malaria agenda. So zero malaria starts with you, it starts with me, and it starts with us. Thank you.
Thank you so much. Bridget, over to you, your parting shot.
Mine would be just to reinforce that it is a shared collective responsibility. We all have a role to play. Certainly the private sector has contribution to make, but we all have a role to play, as I said, big or small. And we also need to commit to this long-term journey. I think we've said we are smart, we are bold, we are brave. We want to draw the line, but we really must draw that line. And some things we know work, we need to make sure we continue to use those tools and services that are available to us. It won't take a year or two, but certainly we can strive to eradicate malaria in this generation so that our children's children do not need to suffer the burden of malaria as a disease.
Well said. Dr. Mably, over to you. Parting shot in a few seconds.
Thank you so much, Waliko. Mine is just that we have a good core intervention that may work with a good results, but we need to close gaps with additional interventions. Innovative tools are very key in our context if we need to go to zero malaria. Lastly, for youth, don't think beyond 15 years. Even below that age, they are concerned and they have a role to play. They can easily identify mosquito breeding sites surrounding their schools, surrounding their house, and can bring you that information to guide decision-making. I think really Youth Army is really needed, and don't think beyond 15 years old, even below that they can help.
Thank you so much. Thank you very much. So as we close, we have a final presentation, which is good as our closing. Ajibola will be taking it away with just an explainer on what malaria means to him. Please remember, after this session, the exhibition is open and you can access it through the auditorium. So if you go back to the auditorium, you'll be able to get there. Over to you, Ajibola. 1 minute.
Yeah, thank you very much. For me, I've had a personal experience with malaria. I once lost a friend. She was pregnant at the time. She was about 27 years then, 29 weeks pregnant, and she had complications of malaria in pregnancy, and we lost her. It was a very turbulent time. It was very painful. Malaria being an avoidable, preventable disease, someone dying from something that is preventable, it's hurting. And even on the front lines, working as a medical doctor in Lagos, Nigeria, I see the burden that relatives have to carry, seeing their children suffer from malaria. Even when a kid has cerebral malaria, we know that some of them get to have regression in milestones, delay in development, and it is very, very disheartening. It is a lot of pain to go through, and it is important for us to intensify our efforts in eliminating malaria. Zero malaria definitely starts with you and I, and it is time for us to draw the line against malaria. I believe that it is something that is highly achievable, and if we put all things on all hands on deck, we can actually do this. Thank you very much.
Thank you, and we appreciate you have your scrubs, you're on duty, you're really taking the forefront to make sure that this is implemented. That is, our time is up, and that is the end of our session. I would like to really thank you, Ajibola, thank all our panelists for their participation. And as we said at the beginning, draw the line, do your part, join the fight for zero malaria.